Well, I started working at Apex in July, so going on about 4 months here now. Before Apex, did primary care training at Meharry General Hospital, then addiction with Vanderbilt Psychiatry. Following that, I worked with Mental Health Cooperative and led their MAT program for a number of years before going to head up Meharry's addiction program and also starting an addiction clinic at a federal qualified health center in Williamson County. So I was working on both of those projects when I'm getting scooped up here in Apex, and I've been here for several months now. Now, what I absolutely love here about Apex is, one, we offer this continuity of care service, and I've noticed many other places you're either in detox or you're in residential or you're in IOP, and being able to offer full spectrum from essentially day of use up to kind of 90 days after treatment is incredible. We were able to have this internal baton handoff, so it's not, a whole host of new folks. And we can really have that solid, stable platform for folks to build that early sobriety on, which makes all the difference. The first 3 months are absolutely crucial. So love that part. Love the philosophy of Apex from our leadership of really putting the patient first. And let's make sure we can do what is needed when it's needed. The rest will sort itself out, but making sure our primary goal is a patient's recovery, is their sobriety, is getting that start off. So that's what I really love about here. I think there is an over-focus and almost paradoxical, it is the substances and is not, because physically removing the substance from one's body is very necessary. Obviously, we can't have recovery from alcohol if we're still drinking, but that's just one tiny aspect of it, right? No one wakes up in the morning and decides, today I'm going to struggle with alcohol. No, it's a process that's happened over time, and so we need to also be pulling back the layers there and really addressing the person from physical, mental, spiritual even, what all else is going on around here that kind of led to that alcohol use. So yes, we will affect the alcohol. Yes, we will help with detox, help with that part, but so much of the overall person. And that's what we really got to get into. So it's much more than just the drugs. This process, this disease, this treatment is more than just the individual, because what we do in use, what we do in this cycle affects so many around. And so that caregiver fatigue, that seeing this person you love go through this again and again and again takes a toll. And so making sure that we have not only the individual person, the individual patient engaged in treatment here, but also the family, and really building that connection, that network. And that's an important part of sustaining sobriety, because as we jokingly say to folks, we never want to see you again, in as much as that when we're done with this level of care, we want that to be able to move forward, and we don't want to be just this revolving door of, come back to rehab, come back to rehab. No, we want this to be a jumping off point. So for family, for other folks engaged with patients, hey, let's bring them on in. Let's help with the entirety of the person, of the community. Yeah, I think the biggest thing is the chronicity, how long it takes to go through this. So if you were to break your leg today, you wouldn't expect to run a marathon this weekend. You'd go to the ER to get the leg put back into position, you get a cast put on. You're still not running a marathon. You gotta have the bone heal back and the cast come off after a month or so. You're still not running a marathon. Then you gotta go through the physical therapy and learning how to use the leg again. You're still not running a marathon. Then you're starting to train for the marathon. And so for whatever reason, when it comes to the brain, to that organ, we seem to just expect, well, we made a decision, it should all be done. And instead realizing that no, this is a journey. This organ has to heal. Blood flow has to come back. We have to reintegrate that into our lives. So that'd be the biggest thing there, of realizing this is a chronic disease. It's not a quick fix, and making sure that we have a plan, not just for today, right now in this moment, but also as we go forward, how do we sustain that recovery? How do we let that healing occur? So many folks coming in here are coming in from areas of a lot of stress, even physical unsafety. And so making sure that we are creating a safe place that folks can begin to unpack, begin to reassess what has happened. And as you're going and almost trying to outrun this avalanche that feels like it's right behind you, when you stop, that avalanche is going to come on up there. So we got to make sure we have a good, safe shelter for that to occur as we're walking through for whatever's happening physically, mentally, or emotionally with folks. So we really do try to make a open and engaging atmosphere, non-adversarial, to know that we're your treatment team and we're here with you. And we're going to meet you where we are, and we're going to walk forward with you. Well, one of the most crucial parts is getting the process started. Because that old saying that the best time to plant a tree is way in the past, second best time is right now. So one of the biggest urgency is getting into treatment. And as you're sitting there thinking, should I not? No, jump on it now, get that process going, because if we never take that first step, the rest of it doesn't matter, it's never gonna come. Secondly, the other big part of that urgency is after we are finishing through that kind of residential, we've gotten things stabilized out, and we're now trying to transfer to that next step. And anytime there is a movement in levels of care, there's a movement in physical locations, that becomes another point of urgency, because that's when you can fall through the cracks. That's when adverse events can occur. So making sure that we are helping with that, and saying with Apex, we do a lot of that in-house, but even when the time here is done, as we're getting plugged into community resources, primary care, psychiatry, therapy out in where you're at currently, that transfer can be as seamless as possible. That we can make sure that that does happen well, and that you're not just left to your own devices and we'll just do whatever. But make sure we have that solid plan.